Alright, so hi guys, my name is Jose. I'm an EMT student. So we're going to be going through bleeding control and shock management. So first of all, when we arrive to the scene, we got to make sure we have PPE, personal protective equipment. Then we're going to go ahead and apply pressure to the wound. So let's assume he's bleeding in the arm. So we will have to apply pressure to that.
The wound continues to bleed?
If the wound continues to bleed, then we will go ahead and move on to the next phase and provide a tourniquet. Since we don't have a tourniquet, we could always use a makeshift tourniquet. So we always want to go up at least 2 inches above the wound and also above the joint. Once we get the pen in there, we could go ahead and give it a few turns, and we're going to make sure we secure it so it doesn't spin out of place. Alright, so the tourniquet is placed on there.
The patient is exhibiting signs and symptoms of hyperfusion.
Alright, so we will go ahead and treat for shock management. And so the first thing we do is make sure the patient is in the correct position. So we're going to go ahead and put him in the supine position. Alright, following that, we're going to make sure we administer adequate oxygen at 15 liters per minute via non-rebreathable mask. So once we had our oxygen tank prepared, we would just insert or connect the non-rebreather mask. Then go ahead and place it on them snugly. Okay, and then once it's done, we're gonna go ahead and maintain body temperature by providing a blanket. So we would put a blanket over him, and then once that is done, we're gonna go ahead and prepare the patient for immediate transport. And I think that should be the end of the scale. Thanks.